We're going to talk about advanced brain tumor imaging over the next half an hour or so. What I'm going to talk about in this presentation is we're going to quickly talk about how we do perfusion imaging and talk about our brain tumor protocol. And then we review some of the clinical applications of brain tumor imaging for tissue characterization and to differentiate post-treatment changes, including pseudoprogression and radiation necrosis from recurrent disease in patients with brain tumors. And then at the end of the talk, I'll talk about MR diffusion and how it can also be applied in imaging of brain tumors and their follow-up. So MR perfusion methods, these are like the 4 types that are available. The top 2, the arterial spin labeling, ASL, and intravoxel incoherent motion imaging, or IVIM. There are basically the perfusion sequences or methods that they don't really need contrast injection, and they use, in case of ASL, it uses blood, and in case of IVIM, it uses the water molecule diffusion to calculate or obtain some perfusion matrices. The 2 at the bottom, DSC, dynamic susceptibility contrast imaging, and dynamic contrast enhanced imaging, or DCE, are the one that they require contrast injection in order to obtain perfusion matrices. And these are the ones that we use in clinical practice, at least for brain tumor imaging that I have for this talk. So we are going to focus on these 2. So this is our brain tumor protocol. Basically, we start with some conventional imaging, T1, FLAIR, gradient images, and then we do our DCE, or for which basically we use a T1 gradient sequence with a relatively high temporal resolution in order of 5 to 6 seconds, and we inject the 40% of contrast that we have for that patient for this acquisition. After that, we do our T2 weighted images and diffusion, or DTI, or whatever. If they order DTI, we put DTI there. Otherwise, we just do routine diffusion. And then we end the study by doing dynamic susceptibility contrast by injecting the remainder of say 60% of the contrast. We use a gradient EPI sequence for DSC with temporal resolution of 1.5 seconds. And then obviously at the end, after DSC, we have to do a T1 post contrast to finish the study.